Good morning, folks, and thanks, Nathan. Thanks a million. My name is Fergal Duignan. I work for PacSana, and our mission is to help older people and the vulnerable live as long as possible in their own homes. It's a real treat to be able to present to this group, and with the core, where everyone has a shared vision and a shared goal of supporting better care. So that's a real privilege, and thank you very much for the time. As many of you know, social care continues to be a terrifically challenging area. So even as we come out of the worst of this pandemic and hopefully start returning to more normal business of health and care, we're revealing a near infinite demand and increased complexity in care needs for the elderly and the vulnerable. I worked in technology for over 20 years, and it can do amazing things, and there's no doubt that there's fantastic solutions on show today here. But having seen where it has its strengths and its limitations, it becomes clearer to me that care is a human business. And while we may undervalue caregivers in terms of how they're resourced and funded, we can do very little in terms of providing excellent care without humans and without human caregivers. So they need as much support as possible. When we started PacSana 3 years ago, we spoke to care agencies, we spoke to caregiving companies, and we spoke to their clients. And the agencies told us that they wanted simplicity, supportability, interoperability, and a nice open platform that they could integrate. Care companies told us that if we enhanced the life of the client and that of the caregiver, and we added to the bottom line that they were interested. And the clients, which is probably my most interested, people I'm most interested in, told us that they were interested in dignity. They wanted a comfortable and an attractive device that didn't mark them out as being in need of help. They wanted privacy. They didn't want to feel that they were being watched, or that there was any kind of a big brother looking at them. And they wanted transparency as well. They wanted to access the data, and they wanted their family and family carers to be able to access data as well. So that informed how we defined how the solution we defined and what we built. And you'll see images of it there. This is the solution in its entirety. It's a pretty straightforward solution. We use a simple bracelet, light, comfortable, in-home gateways, cloud-based machine learning and artificial intelligence, which we present as notifications and visualizations for the family carers, the care companies, and those with a role of providing care. This is the bracelet. I don't know if you can see it. I can't see my screen, so I'm hoping that you can. It's light. It's got one. This is the technology piece. This is how we replace the battery. We do that once every 6 months, and that connects to the in-home gateways. Typically the battery lasts for 6 months, or in excess of 6 months. But we've had these in the field for over 18 months now, and the compliance rate is really, really high. Waterproof, wear 24/7, and move on. This is the gateway device for the UK. As you see, you don't lose a plug from using it. And these are connected to Wi-Fi or mobile internet, which we can provide and support. The gateways can communicate with our Microsoft Azure platform, which we then present our visualizations and our notifications from. This is a sample of the visualizations. This is available on a mobile app for iPhone and Android, and for caregivers in a consolidated screen that shows each group that the caregiver is responsible for. But on your left, you might see somebody's. This is a user who's in their 80s, active person, very solid activity levels. On the outer layer, you see the location. On the inner layer, you see the activities that support that. The status, as you see, is by location, by time, activity level, and presence. And this is what we do very, very simply and confidently. Well, just for so you know, we're releasing our next version, which will have velocity of movement and exercise, so that'll add additional color to it. And that's a project that we're about to go live with. If you look to the middle circle, you'll see that this user is slightly earlier to bed. This is the same user, so you know, slightly earlier to bed, but again, you know, solid rest periods, similar activity levels, not much to worry about. But on the right hand side, the last screen, you'll see there's a lot of nighttime activity, a lot of waking movement, and for this user, that this is indicative of a sleepless night, which is not a problem. But for dementia sufferers or other users, this could be a really a telling evolution of their behavior. So that's the system in its simplest form. The notifications that we drive, again, fairly simple. In the bedroom for extended period of time, in allocation for periods that a bit longer than we expect. And these notifications evolve over time. This is kind of out of the box functionality. Absence from home is really important for some users. Absence at any stage for certain users is really critical, and we can flag that. But what we look for is evolving patterns, step changes that we can address and show and discuss, because we're not a clinical device, but we are informing and providing color and evidence of care needs. And again, sorry, there's an alarm button activation that can be incorporated into the solution as well. In terms of where we work, you may have seen Ryan Williams from Connected Health present on the PacSana solution, supporting their caregivers in Lisburn, in rural Lisburn. That's a very successful pilot. We started that in January of 2020, and we're ongoing. We've recently just replaced all their hardware, and we'll continue to support that group. And the outcomes that are improving are really quite telling and very touching. Oh, Nathan, I'm not finished yet. Hold on. Give me a second.
Yeah.
You blocked out my screen. I can't see it.
No, let me come
We're working with the pulmonary rehab team in Beaumont Hospital in Dublin, and to support their long COVID and COPD customers. And we are also working with supporting dementia support units in Sligo's ICTOP. We are also working with a global healthcare provider to provide evidence of care needs rolled into their individual care plans. So finally, our last slide is, of course, yeah, we are targeting a cost of £20 per user per month. And please get in touch. We are recruiting partners and pilots all the time, and we would love to hear from you and just have a conversation. So please get in touch, and we'll take it from there. Thanks, Nick.